Good afternoon, everybody. My name is Sadhguru Pandit, and welcome to the Health Chat at Nanavati Super Specialty Hospital. Today, we have with us Dr. Pradyumna Oak. Dr. Oak is the head and director of neurology at Nanavati Super Specialty Hospital. He also spearheads a stroke unit, which claims to have the shortest door-to-needle time of less than 30 minutes. He has a vast experience of over 18 years, and he's here today to talk on the occasion of World Stroke Day. So, Dr. Oak, today is 29th October, which is celebrated as World Stroke Day. Can you tell us what is the significance of this day and why do we need to celebrate it?
So 29th October is the World Stroke Day. It is celebrated to increase the awareness of stroke. In fact, it's the second killer disease after heart attack. 4 out of 5 people don't know what stroke is. And when a stroke happens, most of the people don't know how to identify a stroke and what to do when a patient develops a stroke. When a patient develops a stroke, 98% of the patients, they don't reach to a stroke ready hospital, or they go to a hospital which cannot offer them the correct treatment. So only 2% of the patients in India right now are getting a correct treatment in the golden hour because they reach to the correct hospital. 98% of the patients, they either don't reach to the hospital in the golden hour, or they go to a hospital where they cannot be offered a correct treatment because these hospitals are not stroke ready hospitals. See, about 2 to 3 decades ago, when I was doing my MBBS, stroke was considered as a veranda disease. So patient who has a stroke used to be kept in the veranda because there is no treatment. Only aspirin and physiotherapy was the only treatment available at that time. But now, if the patient comes to us in the golden hour, we can reverse the neurodeficit caused by stroke by giving specific treatment, and for that patient has to come to a stroke ready hospital. So it is important to recognize a stroke and reach the hospital as fast as possible. So basically, World Stroke Day is observed to underscore the importance of stroke and to increase the awareness of stroke so that we can reduce the disability caused by stroke in the community, as well as we can have measures to prevent stroke in the community. So we at Nanavati Super Specialty Hospital, we are starting a stroke helpline. Let's have a look at this small video.
Every day we step out to treat, to care, to heal. We ensure a safe and secure environment for our patients to recuperate. Nanavati Super Specialty Hospital. We stand guard to your health. We are prepared. We are ready.
So, sir, you have launched a special stroke helpline. Can you tell us about the significance of this helpline and how will it benefit the people at large?
So basically, this is a 24/7 stroke helpline. If you develop any of these symptoms, you don't have to think what you should do next. You have to contact us on this helpline. We will analyze your symptoms and we will guide you as to what should be done so that we can recognize that this is an acute stroke and you will get a correct treatment at a stroke ready hospital like at our center.
Great. So, sir, can you tell us 3 major reasons or causes or symptoms when patients should reach out to you and should dial this helpline?
We call stroke as a brain attack. So we know that how heart attack is, it's sudden onset of chest pain. Similarly, stroke is always like a lightning. It's a brain attack. So patient will develop sudden onset of symptoms. So common symptoms of stroke are called as FAST, F, A and S. So F stands for face. So if you look at the face of the patient, you will find that there is some facial deviation or there is some asymmetry in the face. Then comes the arm. So we all know that when a stroke happens, patient will develop some weakness of the arm. So if you ask the patient to lift both his arms, one arm will automatically droop or he will not be able to even move that arm. Third is speech. When a patient develops a stroke, he will have difficulty in speaking. We call this as a dysarthria or difficulty in speaking. So these 3 are very important signs of or symptoms of stroke, which is called as F, A and S. Now anybody in the family or you develop these symptoms, you have to communicate with us or you have to contact us so that we can help you to recognize that it's a stroke and then we can treat you in a better way.
So, sir, what is a stroke ready hospital? And what makes that hospital different than any other tertiary care hospitals in the city?
A hospital where there is a stroke neurologist, where there is a CT scan center, where there is a MRI machine, where there is a cath lab, where there is a neuro intensive care available under one roof. So that if, for example, if you go to a nursing home, they will diagnose you correctly that you have a stroke, but they will send you to a CT scanner or a MRI center for investigation. You will come back, the report will come later. So during that time, you have lost that golden hour where you can be treated. So you will be diagnosed correctly, but you can't be treated correctly. So if you develop symptoms of stroke, you have to reach or you have to go to a stroke ready hospital for right treatment.
So, sir, how important is timely treatment when it comes to stroke?
So when you develop a stroke, we call that there is a golden hour. So in that golden hour, the brain tissue is not dead. So if we give treatment in that golden hour, we can reverse the neurodeficit, we can reverse the paralysis. And that golden hour lasts up to 4.5 hours. So you have to reach to a stroke ready hospital in that golden hour. So when a patient develops a stroke, he will have weakness of one side, but this is reversible up to 4.5 hours. A minute delay in treatment is costing you up to 2 million neurons. So you have to reach to a stroke ready hospital fast. If you don't go to the hospital and if you don't get right treatment in the right time, you will remain with the weakness or you will remain with the permanent disability.
Thanks a lot, sir. That was an insightful talk today. And wish you all a very happy World Stroke Day. I hope all of you remain healthy, remain fit. And whenever you have any queries about stroke, you can dial the helpline, the stroke helpline, which we have just recently launched. Stay tuned and please join us for our next health chat at Nanavati Super Specialty Hospital.